Vanakkam, Namaste and welcome to Dr. Shah's Clinic. In yet another video on erectile dysfunction, I'm going to answer the question or answer this question that I get from a lot of my patients. Dear doctor, my boyfriend has erectile dysfunction. What should I do? So if you're in a relationship and if you're in a long-term stable relationship, you find your partner or boyfriend or your husband has erectile dysfunction, what are the things that you should do? And more importantly, what are the things that you should not do? That's exactly what we're going to see in this video. So remember, an individual is said to have erectile dysfunction if he's unable to sustain his erection or is able to attain an erection of sufficient rigidity to allow penetrative sexual intercourse. So that's the definition of erectile dysfunction. And if you notice that your partner or your boyfriend is unable to sustain his erection during repeated or during multiple sexual intercourse sessions, then a suspicion of ED should definitely come to the mind. What's also very important here, to remember is that, especially with older men, the causes of ED are, primarily centered around diabetes, hypertension, dyslipidemia, and the usage of certain medications and other medical conditions. Whereas with younger individuals, the diagnosis of ED could be more related to psychogenic factors as well as certain lifestyle habits. So if you're in a relationship with someone who's young, here are some things that you can do right away if you suspect your partner has erectile dysfunction. First, ask your partner or boyfriend to get his blood sugar assessed. Even today, we are looking at even young patients who are in their early 30s or their mid 30s. A lot of young men are developing diabetes, or they have impaired fasting glycemia, or they are in a state of pre-diabetes. So definitely get their blood sugars assessed. That's the first thing to do. Second, remember, if your boyfriend or your husband or your partner is working in a high stress job, and if you think he's always stressed most of the time, get his BP assessed. It's fairly simple. You can do it in any clinic near you. Get his BP assessed and see his systolic as well as diastolic blood pressure. The third most important thing to do, if your boyfriend has erectile dysfunction, is to check his blood cholesterol levels, or more specifically the blood triglyceride levels. So if you feel your boyfriend eats a lot of junk food and does not eat healthy, you have to check his blood triglyceride levels. The fourth important thing that you should probably do is, also take a waist to hip ratio measurement, or if you see a waist size, or if you think his waist size is over 40 inches, ask him to lose weight, ask him to hit the gym or go for walking regularly. Now, these are all simple things that you can do on your own. You really don't need any expert guidance or expert, intervention at this level. So these are all simple things that you can check. So, but if your boyfriend has diabetes or your husband has diabetes or cholesterol, hypertension, definitely visit a general physician or a sexologist or an andrologist near you to get the right treatment for the same. So normally with healthy walking, healthy lifestyle, healthy food habits, most of the time a large proportion of patients, will note some improvement in their erectile function. Moreover, what's very important is you have to also be very supportive. Most women, kind of tend to do the mistake of judging the individual on his erection. And usually during sexual intercourse, sometimes, women verbally state that I was not satisfied, or the erection was not hard enough, or you were not hard enough. So certain verbal statements during the sexual intercourse session should be avoided. And what I would advise you, if your boyfriend has erectile dysfunction, is keep those statements post-session, or after the session is complete, or at a different time where you're completely relaxed. So try to have an open communication, and try not to be very forthcoming about the problem. In the sense, don't be very direct. Try to be gentle. Try to be soft, because the second you say that a man has the second you tell a man that his erection is not good, or dissatisfied in bed, what's basically going to happen is it's going to affect his self-esteem, although that's a very bad word to use. It's also going to affect his ego, his persona. More importantly, he's going to have performance anxiety every time he tries with you. And because of that, what's going to happen is it's a vicious circle. The number of times erectile dysfunction manifests in consecutive sexual attempts is only going to go up through the roof, and it's going to really break down the relationship. Now, so what you should do basically, if your boyfriend has erectile dysfunction, is basically get the sugar, the cholesterol, the BP assist, ask him to hit the gym, go for walking. And definitely, if these measures don't work out, definitely go visit a sexologist near you or an andrologist near you. Get him on medications, PDE5 inhibitors. These are the drugs that are used for treating erectile dysfunction. And give him some counseling. Get couple counseling, because it's always better. Sexual partner engaged treatments are extremely well validated, are extremely scientific, are extremely proven. So get couple counseling as well. And try to be open, try to be gentle. What you should not do if your boyfriend has erectile dysfunction is don't be harsh, don't be rude, don't be too direct. And do not speak about, his erection or his sexual performance during the act of sexual intercourse itself. That's what turns off most men. And he will eventually start losing interest in you. You will start losing interest in him. and it won't work well for your relationship. So these are some points that you should definitely bear in mind. I hope you found the video informative. Please like, comment and subscribe. Share this video with all your friends and loved ones. This is Dr. Shah. I'll see you soon. I'll see you back soon with another video.